hospitals actually even self-sufficient.
To achieve the key vision of universal healthcare in Nairobi County, in August of 2020, I commissioned the construction of 24 hospitals across Nairobi's 17 sub-counties with focus on informal settlements and other underserved areas. This program has since expanded to target the construction of 28 new hospitals and the expansion as well as the rehabilitation of 4 more hospitals across the county. We have so far commissioned a total of 13 hospitals, the first being in Uhuru, Level 3 Hospital, which we commissioned in February of 2021. The commissioned hospitals have so far attended to over 95,000 patients, including inpatient services, surgical services, outpatient services. These new Level 2 and Level 3 hospitals are fully equipped with modern medical equipment and staffed with more than 2,000 health workers, and we are confident that these facilities and these health workers will ensure that the population of 3.1 million people living across our informal settlements will be able to access quality and affordable health services with ease without having to travel great distances. The Nairobi Metropolitan Service has already identified, registered, and qualified over 326,000 vulnerable people for NHIF support, and 66,000 households have already started enjoying the service with NHIF